Hi there, students. Yeah, so I'm gonna try and get the best angle and visual for y'all. Acupuncture, because the needles are so fine, is notoriously difficult to film. That's why we're not in as many movies as we'd like. All right, so I'm gonna move this guy over here just because I want to give y'all a look at the whole sequence insofar as I do it anyway. So something you all may or may not be aware of is that a lot of the freehand needles, when they're single packed, come with this little doodad in here, which they get everywhere, so be prepared for that. So I just take it out like so, and I put the little doodad wherever. Taking the pin out of the grenade there. Yeah, so this is the first skill that I want to teach y'all. So this is the basic hand position that I use for freehand needling, okay? So the way this works is, so you're gonna wanna, you can roll the needle in your hand if you wanna, between your fingers if you wanna change the angle of it. You wanna get it lined up with your middle finger here, okay? Because your middle finger is gonna serve as your post for needling, okay? So I'm showing you in the air now just so you can get a better angle of it, but the way it looks on the patient is like so, okay? So important things to keep in mind. I want to keep my wrist as aligned with my hand as possible. I don't want to be here. I don't want to be way up here, all right? Sometimes you may find occasion to be, here, let me fix my angle here. Sometimes you may find occasion to be here to steady yourself, but more often than not, you'll be up like so, okay? You won't stab yourself in the fingernail like I did. All right, so the basic idea of this, here, let me see if I can show you. Nah, I don't know if you'll be able to see from there. Yeah, but so the basic idea of this is I'm using my middle finger both as a post and as a guide, all right? So I slide the medial aspect, or rather the medial aspect of my index finger and the lateral aspect of my thumb down the medial aspect of my middle finger, okay? All right. So I want y'all to start by practicing without the needle even. So just practice this motion, all right? These are what we call your needle push-ups, okay? And this is going to be important for developing both the strength, the dexterity, and the flexibility to get this range of motion to where it feels effortless for you, okay? Oh, you can probably see from here. So you see how I'm sliding my thumb and forefinger along my middle finger like this? I'll show you with the needle. Yeah, so here, and you see how the needle slides along my middle finger here? Now the object of it is to get as straight an insertion as possible so that you don't bend the needle on insertion, which can cause pain and will be less accurate, okay? Now, important to keep in mind when we're doing freehand needling, this is always going to be less consistent, all right? So because there's simply more variables in your dexterity, you know, some of us like me have been doing body work for years and have some arthritis built up in the fingers already, you know, so, and, you know, depending on how much coffee you've had, you know, your fingers will be more or less steady. But the idea of this is that my middle finger serves as a post and a guide to add both stability and precision to my insertion, okay? So the first two exercises are your needle push-ups without the needle, okay? That's how it looks from this angle, okay? And I like to get these three fingers here because I think that adds more stability. So my general rule is as much contact area with the patient or whatever surface you're needling as possible. That's going to give you more sensitivity and also more stability in your needling, okay? So that's drill number one, is just your needle push-ups without the needle, and then your needle push-ups with the needle. You can tell I've just done some heavy body work because my hands are a little less dexterous than I might like them. And then your needle push-ups into a surface, okay? And now the idea is you do this about 1,000,000 times, and eventually, I've been doing this a little while, so my needle's not going to bend, but eventually you'll find that you probably are going to miss one and your needle will bend, okay? When that happens, you just chuck it and get a new needle, all right? And be prepared to do this. You know, I do this just while I'm sitting there watching TV, you know, doing whatever I got to do. No surface was safe when I was in school, so yeah, get used to needling a variety of surfaces so you can get a feel for different kinds of media to needle into, okay? And you want to go slow, all right? Try it at different tempos. Here, slow, and then you can go fast. All right.